Okay, so this is a hot take about weight loss meds. So I personally think that a lot of people who are taking GLP-1 medications for weight loss are on way too high of a dose. Let me explain. I'm Tiffany. I'm a physician assistant that works in internal medicine, and I'm a huge advocate for GLP-1s to help you lose weight. But here's a huge problem that I see in my practice. So when we start GLP-1 medications on people, we start them at standard doses. How do you know these doses? It's the doses that were approved by the FDA. Well, how did the FDA come up with these doses? Well, through the doses that the clinical trials were actually based on. So when they set up the clinical trials, they usually set them up in a specific way. So the two drugs that are out right now, Semaglutide and Tirzepatide, were both studied in the format where they started off on a standard dose for the first month, and then after that month, they titrated up to the next dose. And then from there, they titrated people up. We know from these studies that as your dose goes up, so do your side effects. Now, granted, in these studies, the people, as their dose went up, their percentage of overall weight loss did go up. But it's a total trade-off, because even if you can lose 20% of your body weight, but you're having terrible side effects from the medicine, then totally not worth it. But let me just tell you what I see clinically. I see people all the time that get started on a very low dose of medication, what's considered the starter dose, and they're doing amazing. They come back in a month and they don't really need to be moved to the next dose because they're still getting really good effectiveness out of that starter dose. The problem with that is that insurance typically says you have to move the patient up to the next dose. It's not the provider, it's not the patient, it's insurance. So I'm actually a big advocate of using compounding for semaglutide and tirzepatide, especially if you don't have insurance coverage, because you really can fine tune your doses. I have known people that have actually been on smaller doses of the semaglutide or tirzepatide for long periods of time and have actually lost a good amount of weight and have not had to be on these high doses. The beauty of that is that they're not having to have all these side effects that we see at the super high doses of meds. So in my personal opinion, you should really try to stay on the lowest effective dose that you can and only move up when necessary. So how do you know when you need to move up? So usually patients will come back to me or express to me that they're starting to get a lot of food cravings, that food noise that they went away at first will start to come back, or they're starting to think about meals a lot or think about snacking a lot, or they're just really starting to get hungry all the time. Now, in a perfect world, if you're taking a GLP-1, I still want you to get hungry. I just want you to get hungry at appropriate times. I want you to get full at appropriate times. Like maybe once you've gotten half your plate eaten, I want you to get full. So I still want you to be able to eat on a GLP-1. If you can't eat at all on a GLP-1, that's not normal. You're on too much medication. And maybe we don't need to lose 50 or 60 pounds in 5 months, okay? Maybe that's too fast. We deal a lot with muscle wasting and loss of muscle because we see people lose huge amounts of weight over a short period of time. Whereas if we did a smaller dose of medicine over a longer period of time, we could kind of let that weight loss stretch out over a longer period. And I really just think that's better off for the patient. So this is just my hot take on it. This is my advice. Again, I am a PA, but I'm not your PA. So always take this up with your healthcare provider. If you think you may be on too much medicine or too high of a dose, maybe chat with your healthcare provider. If compounding seems like maybe it would be a good option for you, there is a link in the bio of my profile in which you can see if you're eligible for the compounded prescriptions. So just check it out if you need to. All right, y'all have a good night.